So those are the 8 muscles of the forearm's anterior compartment. So just an interesting note about Flexor Digitorum that I'd like to illustrate. Flexor Digitorum Superficialis. So if you think about what you would intuitively think, if the Flexor Digitorum Superficialis lays over the Flexor Digitorum Profundus the whole way through, you would expect the Superficialis to attach more distal. For it to attach more proximally, at some point it has to pierce it. So Flexor Digitorum Superficialis actually attaches onto the middle phalanx, and in doing so, when you flex it, it flexes the proximal interphalangeal joint. So this joint here. Because it is attached there, it has no action on this. So the distal interphalangeal joint is not affected by the FDS action. It's only the proximal. The Flexor Digitorum Profundus, if you follow it here, so on the right side of the diagram, it's deeper to Superficialis. As it comes along, it goes through, essentially, the tendon of the Superficialis and attaches more distally onto the distal phalanx. Because it's there, when it contracts, it primarily acts on the distal interphalangeal joint, but can have some action on the proximal as well. And this is quite important, as I'll come on to next week, when you think about which muscle is affected by a palsy. So when a superficialis fails, you don't get any contraction of the proximal joint, but the distal joint's fine. When the profundus fails, you get failure of the distal joint, so that can't move at all, and the proximal joint can move, but is weaker, because it's lost one of the muscles, so the profundus, but not the superficialis.